Prairie Mountain Health is currently looking for dedicated physiotherapists and occupational therapists to join our therapy services team. Located in the southwestern portion of the province, Prairie Mountain Health spans a geographical area of over 64,000 square kilometers. Our landscape is beautiful, from the forested areas in the north to the sandy desert in the southeast. We boast stunning lakes, hiking trails, provincial and national parks that are teeming with wildlife, and there are many small, supportive communities great for raising families. Prairie Mountain Health serves a diverse population of over 169,000 people and employs over 8,500 employees. Outside of the Winnipeg Regional Health Authority, we are the largest healthcare employer in Manitoba.
My name is Matt Zeiler. I'm a physiotherapist at the Brandon Regional Health Centre. I've been working here for 5 years.
Hi, I'm Jenna Mills. I'm an occupational therapist. I've worked in the region for almost 12 years.
Physiotherapists and occupational therapists in Prairie Mountain Health often follow clients through their continuum of care. This can include working with inpatients, outpatients, community or home care clients, or residents living in long-term care.
As an occupational therapist, I see clients of the more of the adult population in care homes, community, and in facilities, acute facilities. I think what's kind of neat is because you're the only therapist that's working in this community, you get to see lots of different diagnoses, and that's really neat to be able to just see all these different clients and all their issues and try to really problem solve with them and try to give them the best care possible. I get to follow a patient or a client basically through the whole continuum of care, which is really cool.
So my role working here at the Brandon Hospital is primarily inpatient care, longer term rehab on the Sinwin Centre. There's a good mix of patients that I'll see, anywhere from neurological patients, people suffering from strokes, other chronic diseases, people who are post-surgical, just having knee replacements, hip replacements, needing that longer-term rehab before they can transition from facility back into home.
There are specific programs that run through adult therapy services, such as prehab for clients planning upcoming orthopedic surgeries, pain clinic, cardiorespiratory programs for clients managing their COPD, and the Functional Independence Program. Pediatric-focused positions are also available. Therapists in Prairie Mountain Health have a level of autonomy over their practices. They prioritize referrals based on competing caseload demands and have decision-making in scheduling patient care within their work week.
Since starting my career as a physiotherapist, I feel that I have progressed in my skills. Just in general, just communicating with patients, being more effective with my treatments, outlining different treatment plans, and just seeing people progress along more efficiently and quicker than what I had when I started my career. I've definitely noticed progress in that as I've come along in my career.
I think one of the skills that you kind of develop as a rural therapist is time management skills, and so you are seeing lots of people in different areas, so you get to learn a ton of different treatment plans and get to work with a huge variety of people. What I find like the most rewarding is you never have like the same day twice, basically. So you get to one day I may be working in a care home and fitting someone for a wheelchair, and the next day I'm in the community and I'm doing a bath assessment. And I really like the variety that I get to have throughout my week and throughout my year.
Prairie Mountain Health offers an alternative to the fast-paced city life. Choose between rural or urban living and working opportunities. Enjoy short commutes and beautiful scenery on your way to work. Prairie Mountain Health even considers reimbursement of moving expenses for therapists that are willing to relocate for a position that falls within the criteria established by the organization.
How I came about coming here, I was in my final year of university at the University of Manitoba. There was a few vacancies within Brandon. They were doing a recruitment initiative that they'd come around to the university, had a talk with our class. There's some opportunity for me to come out here as a placement as a student. It's a really good opportunity just to get some exposure, kind of meet the other staff working here, kind of treat it like a 6-week internship. I had a lot of fun on my placement. Placement went really well. I was actually able to interview during my actual placement here, and then before I had even finished the program at U of M, I had a job offer, so it actually worked out really well for me transitioning from school straight into the workforce when I came out here.
I think one of the things that attracted me as a new grad was that there was full-time permanent positions basically that were available to me. So I was able to, before I even graduated university, I had a permanent position.
For prospective candidates coming out to work in PMH, I would say definitely give it a try. I know for myself, just personal experience going to school, I know that there is some hesitation just coming out a little bit more remote, but personally I've had students who have come out here and had great experiences. Some of those students actually jumping on board and being employed with us.
There's no place like Prairie Mountain Health. Let us welcome you home. Visit our website to view vacant positions and apply online. It's more than a job, it's an opportunity.